Everybody, this is Voss. We're going live today talking about Medicare Q&A, some things that came up this week, last week, because this week is Monday. Just want to talk about carrier plans and the Part D drug plan. So if people are on a supplemental plan, they have to have a Part D drug plan. So the supplemental plans, if you're going through open enrollment, the underwriting, most people have to go through underwriting again. If they want to change plans from the G to an N or G to a G, they're going to go through underwriting for the supplemental plans. But then the prescription drug plans, the other one tied to it, the Part D plan, it needs a reboot. So maybe you need to update your Part D plan. Well, the carriers have been taking the drug plans off of our enrollment platforms and putting them onto their websites or just Medicare.gov. That is kind of an issue because it doesn't allow us the chance to review a lot of the plans and help the client with. And some of the Advantage plans too, the carriers have been decommissioning and or pulling them off our platforms to help review things. There's still a lot of plans available that are good, and most of them have, doctors in network. But as an agent, we're sitting down with a client reviewing the drugs, the doctors, the dental, vision, hearing, the lifestyle, what their income is, what somebody can afford, what the need is in order to find something that fits. Now, if we don't have access to everything, then that's not good. That's not right. We should at least have access to more plans available, whatever's available on the market. But I get it. There's been cutbacks, and carriers have to cut things out, and that's fine. So cut them off and end it, and we'll move on. The one thing I wanted to get to before I get too far off on that is the drug plan. So if the drug plan is on the carrier site and the carrier says you can go to our site and sign up for your own drug plan, well, you're not an insurance agent. How many times have you filled out this application before? We fill it out, a couple hundred times a year. So we know it. And it's not just a walk through. So you go through it and you could make a mistake, and that mistake could cost you your plan. And then you don't have anything come January and you don't know because you thought you did it right. We'll help you go through some of that stuff. But when that happens, the agent isn't the agent of record. So we help you. And then, we kind of keep in touch through the course of the year to make sure everything's going okay. If the carrier becomes the agent of record over the agent, then the carrier has permission to contact you whenever they want. And if you have a drug plan, they're going to contact you and hammer in an Advantage plan. And you know what? Maybe the supplement's what works best for you, and that's what we talked about, and you're okay with that, and the premiums are okay, and it's working out because you're traveling. They're going to call you back, and they're going to hammer that Advantage plan in you as get the drug plan, get some dental, vision, hearing. How would you like a gym membership? We'll wrap all this stuff into one for you. Wouldn't that be great? And you're like, yeah, that'd be great. And then little do you know, you're on an Advantage plan come January, and you can't have an Advantage and a supplement. So what do you do? So just keep that in mind when you're signing up for a drug plan this year and you have to go to a carrier site or Medicare.gov. Give an agent a call. We'll walk you through it because we're your agent. We'll help you out with the supplement, the drug plan, hospital indemnity, final expense, long-term care insurance, whatever it is. Sorry, I picked up the letter opener. So we'll help you out with stuff like that. We won't be compensated for the drug plan, but then also keep in mind that they'll be calling you. So if you get calls from the carrier saying, hey, would you like this? Be like, no, I'm okay. Just let them know. No, you're okay. You know what? I took care of it. I don't need that. Thank you for calling. Please don't call me. Or else they will just call you and hound you and try to get you to switch. So that's the big thing that right now. There's a lot of big things going on this year. A lot of cutbacks with the Advantage plans and the drug plans, and we're just trying to all weave through it. But there were a lot of plans dropped this open enrollment. United Healthcare dropped all their PPOs, so we're trying to work through and get to everybody on the list. Just be patient, and we still got a couple weeks left. Everyone will make this happen. So be patient with all the agents out there, just trying to make a difference and help people out. Hope you have a great evening, and we'll talk to you later. If you need anything, just let us know, and we'll send an agent out to help.